Do you take medication every morning with your breakfast? What if I told you that one of those pills sitting in your medicine cabinet right now could be doubling your risk of a heart attack? I'm Dr. Lucas Bennett, a board-certified physician with over 20 years of experience in preventive cardiology. Today, I'm going to reveal 5 commonly prescribed medications that, after age 60, may be putting your heart in serious danger. This isn't about stopping your medications, it's about having the right conversation with your doctor before it's too late. Here's what concerns me most as a physician. I see patients every single week who are taking medications that were perfectly safe when they were 45 or 50, but now that they've crossed into their 60s, these same pills have become silent threats to their cardiovascular health. The problem is that most doctors are incredibly busy, and medication reviews often get overlooked during routine appointments. Meanwhile, your body has changed dramatically since you first received that prescription. The statistics are alarming. Research from the American Heart Association shows that adults over 60 take an average of 4 to 6 prescription medications daily. Yet studies indicate that up to 40% of these prescriptions may be inappropriate for this age group due to increased risks that outweigh the benefits. In my clinical experience, I've witnessed preventable heart attacks, strokes, and sudden cardiac events that could have been avoided with a simple medication adjustment. The truth is, your aging heart doesn't process drugs the same way it did a decade ago. Your kidneys work more slowly, your liver metabolizes medications differently, and your blood vessels have become more sensitive to certain chemical compounds. What makes this even more critical is that many of these medications were approved based on studies conducted primarily on younger adults. The long-term cardiovascular effects on the 60-plus population weren't always thoroughly examined. This means you could be taking something that your doctor prescribed with the best intentions, not realizing that emerging research has revealed serious cardiac risks for your age group. Before we dive into these 5 medications, I want to be absolutely clear. This information is for educational purposes only. Never stop or change any medication without consulting your physician. What I'm giving you today is the knowledge you need to have an informed, potentially life-saving conversation with your healthcare provider. Danger number 5. Non-steroidal anti-inflammatory drugs. The everyday pain reliever harming your heart. Let's start with something millions of Americans take without a second thought. NSAIDs like ibuprofen and naproxen. You might know these as Advil, Motrin, or L. These over-the-counter pain relievers seem harmless, right? After all, they've been around for decades, and you can buy them at any grocery store. Here's what you need to know. After age 60, regular use of NSAIDs significantly increases your risk of heart attack and stroke. Studies published in the European Heart Journal found that people over 60 who take NSAIDs regularly have up to a 50% higher risk of experiencing a major cardiac event compared to not. Think about that for a moment. A pill you take for your aching back could be setting you up for a heart attack. Let me explain the mechanism in simple terms. Think of your blood vessels like garden hoses. NSAIDs cause these vessels to constrict and become less flexible. At the same time, they interfere with the delicate balance of prostaglandins, natural chemicals that help regulate blood pressure and prevent blood clots. When you're younger, your cardiovascular system can usually compensate for these effects. But after 60, your blood vessels are already stiffer from decades of wear and tear. Your blood pressure regulation isn't as efficient, and your clotting factors are different. Adding NSAIDs into this equation is like throwing gasoline on smoldering coals. I had a patient, let's call him Richard, a 63-year-old retired teacher who took ibuprofen 3 times daily for chronic arthritis pain. He'd been doing this for 5 years without any issues, or so he thought. During a routine stress test, we discovered significant arterial inflammation and early signs of coronary artery disease. When we reviewed his medications and supplements, the daily NSAID use jumped out immediately. We switched him to alternative pain management strategies, including acetaminophen for breakthrough pain, physical therapy, and targeted exercises. 6 months later, his inflammatory markers had dropped significantly and his blood pressure had improved. So what should you do? First, talk to your doctor about alternatives. Acetaminophen Tylenol doesn't carry the same cardiovascular risks, though it has its own considerations for liver health. Consider non-pharmaceutical approaches. Physical therapy, acupuncture, gentle exercise, heat therapy, and weight management can all reduce pain without the cardiac risks. If you absolutely must use NSAIDs, use the lowest effective dose for the shortest possible time, and never take them daily without your doctor's explicit approval and monitoring. Danger number 4. Certain diabetes medications when blood sugar control backfires. Moving to number 4. We need to talk about a class of diabetes medications called sulfonylureas. These include drugs like glyburide. If you're taking medication for type 2 diabetes, there's a good chance you've been prescribed one of these at some point. Sulfonylureas worked by forcing your pancreas to produce more insulin, which helps lower blood sugar. Sounds good, right? The problem emerges after 60 because these medications can cause dangerous episodes of hypoglycemia severely, low blood sugar, and research has linked them to increased cardiovascular mortality compared to newer diabetes medications. Here's what happens in your body. Sulfonylureas work indiscriminately, pushing your pancreas to release insulin regardless of whether you actually need it at that moment. When you're younger, your body has multiple backup systems to prevent your blood sugar from dropping too low. After 60, these protective mechanisms become less reliable. Your liver doesn't respond as quickly to release stored glucose. Your hormone responses are blunted, and you may not feel the warning signs of hypoglycemia as clearly as you once did. The cardiovascular connection is even more concerning. Studies suggest that sulfonylureas may stress the heart muscle by affecting potassium channels in cardiac cells. This is called ischemic preconditioning, and essentially means these drugs might make your heart less able to protect itself during a cardiac event. Research published in the Journal of the American College of Cardiology found that patients over 65 taking sulfonylureas had a 30% higher risk of cardiovascular death compared to those taking metformin or newer drug classes. I remember Margaret, a 67-year-old grandmother who'd been on glyburide for 8 years. She came to me after experiencing several episodes of confusion and shakiness, which her family attributed to senior moments. When we checked her blood sugar during one of these episodes, it had dropped 2 dangerously low levels. Moreover, her cardiac workup showed concerning changes in her EKG. We transitioned her to metformin combined with a newer class of diabetes medication called SGLT2 inhibitors, which actually provide cardiovascular protection. Within 3 months, her hypoglycemic episodes stopped, and her heart rhythm normalized. The solution here is to ask your doctor about newer diabetes medications that not only control blood sugar but actively protect your heart. GLP-1 receptor agonists and SGLT2 inhibitors have been shown in multiple large studies to reduce heart attack risk, not increase it. Metformin remains an excellent first-line choice for most people. And remember, lifestyle modifications maintaining a healthy weight, exercising regularly, and following a balanced diet can sometimes reduce or eliminate the need for medication altogether. Before we continue, if you're finding this information valuable, please hit that subscribe button. I share evidence-based health insights like this every week to help you protect your health as you age. Danger number 3, older antihistamines, the allergy medicine affecting your heart rhythm, Number 3 on our list might surprise you. First-generation antihistamines like diphenhydramine and hydroxyzine. You probably know diphenhydramine as Benadryl, and it's also the active ingredient in many over-the-counter sleep aids like Tylenol, PM, and Advil. PM. These medications have been around for generations, and many people consider them completely safe. After all, they're available without a prescription. But here's the critical issue for the 60-plus population. First-generation antihistamines have strong anticholinergic properties, meaning they block acetylcholine, a crucial neurotransmitter in your body. This blocking action doesn't just stop your allergies, it affects your heart rate, blood pressure, and cardiac rhythm. Let me paint you a picture of what's happening inside your chest. Your heart has an electrical system that coordinates each heartbeat. This system relies on a delicate balance of chemical signals, including acetylcholine. When you take a medication that blocks acetylcholine, you can disrupt this electrical system, potentially causing irregular heartbeats called arrhythmias. After age 60, your heart's electrical system is already more prone to these irregularities. Your conduction pathways have changed. Your heart muscle may have areas of fibrosis, and you might have underlying coronary artery disease you don't even know about. Adding an anticholinergic medication is like throwing a wrench into an already stressed electrical grid. The research is clear and troubling. Studies have shown that regular use of strong anticholinergic medications in adults over 60 is associated with increased risk of cardiac arrhythmias, elevated heart rate, and even sudden cardiac death. Additionally, there's compelling evidence linking these medications to increased dementia risk, but that's a topic for another video. I had a patient named Thomas, a 65-year-old engineer, who took Benadryl almost nightly to help him sleep. He'd been doing this for years without any apparent problems. During a routine exam, I noticed his heart rate was higher than it should be, and his EKG showed some subtle but concerning changes. When I asked about his medications and supplements, the nightly Benadryl emerged. We switched him to melatonin for sleep and a non-sedating antihistamine for his seasonal allergies. Within 2 weeks, his resting heart rate had dropped by 15 beats per minute, and he reported feeling more energetic during the day. So what are your alternatives? For allergies, second-generation antihistamines like loratadine, atrazine, or fexofenadine don't cross the blood-brain barrier and have minimal anticholinergic effects. For sleep, consider melatonin, magnesium, or cognitive behavioral therapy for insomnia, which research shows is more effective than sleeping pills in the long term. Create a sleep-conducive environment. Cool, dark, quiet, and free from screens at least an hour before bed. And if allergies are a persistent problem, talk to your doctor about whether you might benefit from allergy testing or immunotherapy. Danger number 2. Testosterone replacement therapy, the vitality booster that may stop your heart. This one is particularly important for men over 60, though I want to address it because it affects families beyond just the patient. Testosterone replacement therapy has exploded in popularity over the past decade, heavily marketed as a solution for low energy, decreased muscle mass, reduced libido, and general aging symptoms. You've probably seen the commercials showing men in their 60s and 70s feeling young again, working out, enjoying active lives. Here's what those commercials don't emphasize. Multiple studies have raised serious red flags about cardiovascular risks, particularly in men over 60. Research published in JAMA and the New England Journal of Medicine found that testosterone therapy was associated with increased risk of heart attack, stroke, and death in older men, especially those with pre-existing heart disease. Let me explain the physiology. Testosterone affects your blood in several ways. It increases red blood cell production, which sounds beneficial, more oxygen carrying capacity, right? But after 60, this can become problematic. Higher red blood cell counts make your blood thicker and more prone to clotting. Think of it like the difference between water and honey flowing through a straw. Thicker blood puts more strain on your heart and increases the risk of dangerous clots that can trigger heart attacks or strokes. Additionally, testosterone can affect your cholesterol levels, potentially raising LDL, the bad cholesterol, and lowering HDL, the good cholesterol. It can also cause fluid retention, which increases blood pressure, a major risk factor for cardiac events. When you're 40, your cardiovascular system might handle these changes without major issues. But after 60, when you likely already have some degree of arterial stiffness, potential plaque buildup, and reduced cardiac reserve, adding testosterone replacement can tip the scales toward disaster. I'll never forget David, a 62-year-old former athlete who came to me 6 months after starting testosterone therapy at a men's health clinic. He was thrilled with his initial results: more energy, better workouts, improved mood. But he'd started experiencing chest pressure during exercise. Our testing revealed that his red blood cell count had skyrocketed into a dangerous range. His blood pressure had increased significantly, and he had developed early signs of coronary artery disease. We immediately stopped the testosterone and started him on therapeutic phlebotomy, controlled blood donation to reduce his red blood cell count. Fortunately, we caught it in time, but he was months away from a potentially fatal heart attack. What should you do if you're considering or currently using testosterone replacement? First, make absolutely certain you have genuinely low testosterone, confirmed by multiple blood tests done in the morning when levels are highest. Many symptoms attributed to low T are actually caused by poor sleep, inadequate nutrition, lack of exercise, or depression conditions that won't improve with testosterone. Second, if you do need replacement, insist on careful monitoring, regular blood tests checking not just testosterone levels but also red blood cell count, liver function, PSA, and lipid panels. Get cardiovascular risk assessments, including blood pressure monitoring and potentially cardiac stress testing. And seriously consider whether the benefits truly outweigh the risks at your age, especially if you have any history of heart disease. Quick reminder, subscribe to this channel so you never miss crucial health information. The next topic I'm covering could literally save your life. Hit subscribe and turn on notifications now. Danger number 1. Proton pump inhibitors, the heartburn medicine. Hurting your actual heart. We've reached the number 1 medication that concerns me most for patients over 60, proton pump inhibitors, or PPIs. These include omeprazole Prilosec, esomeprazole Nexium, lansoprazole Prevacid, and pantoprazole Protonix. If you've ever had acid reflux, GERD, or heartburn, there's a good chance you've taken or are currently taking one of these medications. PPIs are among the most commonly prescribed medications in America, and millions more people buy them over the counter. They're incredibly effective at reducing stomach acid, which makes them seem like miracle drugs for anyone suffering from heartburn. But here's the alarming truth that's emerging from recent research. Long-term PPI use, especially in adults over 60, has been linked to significantly increased cardiovascular risk. Let me break down what's happening in your body. PPIs don't just shut off acid production in your stomach, they have system-wide effects. Recent studies have discovered that these medications interfere with the production of nitric oxide, a crucial molecule that keeps your blood vessels flexible and healthy. Nitric oxide is like the lubricant that keeps your cardiovascular system running smoothly. It helps your blood vessels dilate properly, prevents excessive clotting, and protects the delicate lining of your arteries. When PPIs reduce nitric oxide production, your blood vessels become stiffer and more prone to inflammation. After age 60, your vessels are already less elastic than they were when you were younger. You already have reduced nitric oxide production as a normal part of aging. Adding a medication that further depletes this critical molecule accelerates vascular aging and significantly increases heart attack risk. Multiple large-scale studies have confirmed this connection. Research involving hundreds of thousands of patients found that those taking PP had a 16% to 21% increased risk of heart attack compared to those not taking these medications. Another study showed that the risk increased with duration of use the longer you take PP, the higher your cardiovascular risk climbs. Perhaps most concerning, this increased risk persisted even in patients without any history of heart disease. But the cardiovascular concerns don't stop there. PPs interfere with the metabolism of clopidogrel, a critical blood-thinning medication that many people take after heart attacks or stent placements. If you're taking both medications, the PPI can make your blood thinner less effective, potentially putting you at risk for clot-related events despite taking your prescribed cardiac medication. Additionally, long-term PPI use has been linked to magnesium deficiency, and magnesium is absolutely essential for proper heart rhythm. Low magnesium can trigger dangerous arrhythmias. These medications also affect your body's ability to absorb vitamin B12 and calcium, both important for cardiovascular health. Let me share the story of Eleanor, a 68-year-old retired nurse who'd been taking omeprazole daily for 12 years. She originally started it for occasional heartburn and never stopped because it worked so well. She came to see me complaining of palpitations and fatigue. Our workup revealed low magnesium levels, vitamin B12 deficiency, and concerning changes in her vascular function tests. When we reviewed her medications, the long-term PPI use was the obvious culprit. We worked together to wean her off the medication using a step-down approach, implemented dietary changes to manage her reflux, and started supplements to correct her deficiencies. Within 3 months, her palpitations resolved, her energy improved, and her vascular function tests showed significant improvement. So what are your options? First, understand that PPs were originally designed for short-term use, typically 8 to 12 weeks. If you've been taking them for months or years, it's time to have a conversation with your doctor about whether you still need them. Many people can successfully transition to H2 blockers like famotidine and Pepcid, which don't carry the same cardiovascular risks. Even better, address the root causes of your reflux. Lose excess weight if needed, avoid late-night eating, elevate the head of your bed, identify and eliminate trigger foods, reduce stress, and avoid tight clothing around your waist. If you do need to continue a PPI, take the lowest effective dose. Use it only when absolutely necessary, rather than daily, and work with your doctor to monitor your magnesium, B12, and calcium levels. Consider taking a magnesium supplement and ensuring adequate B12 intake through diet or supplements. If this video has opened your eyes or given you actionable steps, please subscribe and share this with someone you care about. This information needs to reach more people. Taking control of your medication safety. Look, I know this information might feel overwhelming. You might be taking one or more of these medications right now, and you're probably feeling anxious about what this means for your health. Take a deep breath. The fact that you're watching this video and learning this information puts you ahead of the curve. Knowledge is power, and now you have the power to protect yourself. Here's what I want you to do, starting today. First, make a complete list of every medication you take, prescription, over-the-counter, supplements, everything. Include the dose and how long you've been taking each one. Next, schedule an appointment with your doctor specifically to review your medications. This isn't a quick question at the end of a visit about something else. This needs to be the main focus of the appointment. Print out this list and bring it with you. During that appointment, ask these specific questions. Is each of these medications still necessary for me? Are there safer alternatives given my age and cardiovascular risk factors? What's the lowest effective dose I can take? Can we work on a plan to reduce or eliminate any of these medications safely? Remember, never stop any medication abruptly without medical supervision. Some medications require careful tapering to avoid withdrawal effects or rebound symptoms. Your doctor can create a safe plan if changes are needed. Beyond medications, focus on the lifestyle factors that reduce your need for pills in the first place. Regular exercise, even just 30 minutes of walking daily, can improve cardiovascular health, reduce inflammation, manage blood sugar, improve digestion, and help you sleep better. A diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats supports every system in your body. Stress management through meditation, deep breathing, or activities you enjoy can reduce your need for sleep aids and pain medications. Quality sleep is foundational. It affects everything from your blood sugar to your blood pressure to your cognitive function. I want you to understand something important. Getting older doesn't mean you have to accept declining health as inevitable. Yes, your body changes with age, but many of the conditions we treat with medications are preventable or reversible with the right approach. Your 60s, 70s, and beyond can be vibrant, healthy, active years, but you have to be your own health advocate. The medical system is set up to treat symptoms with prescriptions. That's not a criticism of doctors. We're working within a system with time constraints, insurance pressures, and pharmaceutical influences. but you have the power to ask questions, request alternatives, and prioritize prevention over pills whenever possible. Your heart has been beating faithfully for 6 decades or more, pumping blood through over 60,000 miles of blood vessels with every single heartbeat. It's worked tirelessly to keep you alive, to let you experience everything life has offered. Don't let a well-intentioned but potentially dangerous medication be the thing that stops it. You deserve better. Your family deserves to have you healthy and present for years to come. This information is for educational purposes only and should never replace professional medical advice. Always consult with your physician before making any changes to your medication regimen. But arm yourself with knowledge, ask the right questions, and take an active role in your healthcare decisions. If this video has helped you, I need you to do 3 things. First, subscribe to this channel so you never miss information that could protect your health. Second, share this video with someone you care about, your spouse, your siblings, your friends who are over 60. This information could literally save a life. And third, leave a comment below telling me which of these medications surprised you most, or share your own experience with medication side effects. Your story might help someone else realize they're not alone. Thank you for trusting me with your time today. I'm Dr. Lucas Bennett, and I'll see you in the next video, where we'll discuss the 5 supplements that most doctors don't know can prevent heart disease. Until then, take care of that amazing heart of yours. You've only got one.